If you're over 60 and your legs are waking you up at night with sudden painful cramping, I want you to hear this clearly. Your body may be trying to tell you something important. A lot of people dismiss nighttime leg cramps as just an annoying part of aging, but sometimes they are not random. Sometimes they are one of the earliest. Little warning bells that something deeper is changing in your circulation, your nerves, your kidneys, your mineral balance, or even the medications you take every day. And when those signals are ignored for too long, the cost is not just discomfort. It can be your sleep, your balance, your energy, your confidence, and your independence. I'm Dr. Thomas Reynolds, and if this has been happening to you, I want you to know two things right away. First, you are not imagining it. These cramps can be intense, frightening, and exhausting, especially when they strike in the middle of the night and leave your muscles sore the next morning. Second, this does not automatically mean something terrible is wrong, but it does mean it's worth paying attention. In the next few minutes, I'm going to walk you through 7 common reasons nighttime leg cramps become more important after 60, what they may be trying to reveal about your body, how to tell the difference between a simple trigger and a warning sign, and what practical steps may help you protect your muscles, your circulation, and your long-term mobility. And I want you to stay with me, because the later reasons on this list are the ones many older adults never connect to leg cramps at all. If you've ever jolted awake with a calf muscle locked up so tightly it feels like a fist is squeezing the inside of your leg, you already know this is not minor. It can make you afraid to go back to sleep. It can leave you walking carefully the next day, and if it keeps happening, it can quietly shrink your world. You go out less. You move less. You trust your legs less. That matters. And before we go further, I'd love to know where you're watching from, and if you feel comfortable, tell me your age in the comments. This community includes people from all over the world trying to stay strong, sharp, and independent. And there is something comforting about realizing you are not the only one dealing with these changes. The first thing nighttime leg cramps may be pointing to is dehydration and electrolyte imbalance. Now I know that sounds almost too simple. You may be thinking, Doctor, I drink water. But this is where many older adults are misled. Hydration is not just about how many glasses of water you had with dinner. It's about whether your body is holding the right balance of fluid and minerals inside and outside your muscle cells. Your muscles work through tiny electrical signals. Think of them like wires in a home. For those wires to carry the message smoothly, they depend on minerals such as sodium, potassium, calcium, and magnesium. When that balance shifts, even a little, muscles can become more irritable, more jumpy, more likely to contract when they should be resting. And after 60, several things make this more common. Your thirst signal may become weaker. You may be taking a diuretic, which can pull fluid and minerals out of the body. You may avoid drinking in the evening because you're tired of getting up to urinate at night. All of that can set the stage for cramps. What does this look like in real life? A person eats slightly during the day, drinks coffee in the morning, maybe takes a water pill for blood pressure, has a modest dinner, then goes to bed slightly dried out, not dangerously dehydrated, just enough for the muscles to misfire at AM. What can you do? Start by spreading your fluid intake across the day instead of trying to catch up in the evening. If you take diuretics or blood pressure medications, ask your doctor whether timing matters. Make sure your meals regularly include mineral-rich foods such as leafy greens, beans, yogurt, nuts, seeds, and potassium-containing foods if those are safe for you. And that last part matters, because if you have kidney disease, you should not start loading up on potassium or supplements without guidance. More is not always better. Better balance is better. And here's the important bridge to the next point. If you keep saying, I know I'm hydrated, so that can't be it, but the cramps continue, then we have to look beyond the simple explanation. The second thing nighttime leg cramps may be signaling is a medication effect. This one surprises people all the time. They assume the cramp is the problem, but sometimes the cramp is the side effect. A number of medications commonly used after 60 have been associated with muscle cramping in some people. Diuretics can shift fluid and minerals. Statins, which many people take for cholesterol, may contribute to muscle pain, tightness, or cramp-like symptoms in certain individuals. Some asthma medicines, some osteoporosis treatments, and even certain blood pressure medications can play a role. That does not mean these medications are bad or that you should stop them on your own. Please don't. It means your body may be reacting to the way the medication affects muscle tissue, circulation, or mineral balance. I often tell patients to think of medication like adjusting the settings on a machine. The machine may still work, but if one dial moves too far, another part starts acting differently. Your legs may be where that change shows up first. This matters especially for older adults because many people are taking several medications at once, and when you combine age-related muscle loss, lower reserve, and multiple prescriptions, even a mild side effect can become very noticeable at night when the body is still and the signals are easier to feel. A smart next step is simple. Write down when the cramps started, how often they happen, where they occur, and whether any medication was added, changed, or increased in the weeks before the cramps appeared. Bring that list to your doctor or pharmacist. Patterns matter. Sometimes a timing adjustment helps. Sometimes a medication review changes everything. And if you're finding this helpful so far, take a moment to like the video and subscribe. Not because it helps an algorithm, but because these are the kinds of quiet warning signs that too many older adults are never taught to connect until much later. The third thing nighttime leg cramps may be hinting at is poor circulation. This is where we need to slow down and pay attention. Your muscles need blood the way a garden needs water. Blood delivers oxygen, minerals, and fuel. If the pipes narrow, the delivery becomes less reliable. During the day, you may notice this as leg fatigue, heaviness, cold feet, or pain when walking. At night, when you're lying down and circulation dynamics shift, some people experience cramping or deep discomfort that gets blamed on just sleeping wrong. One important condition here is peripheral artery disease, which means the blood vessels supplying the legs have become narrowed by plaque. In plain English, the highway feeding your leg muscles has become congested. The muscles are still trying to live on regular deliveries, but the supply trucks are getting delayed. Now, not every nighttime cramp means poor circulation, but if cramps come with leg weakness, slow healing foot wounds, colder skin on one foot than the other, or pain in the calves when walking that improves with rest, that is worth discussing promptly with your physician, especially after 60, especially if you have a history of smoking, diabetes, high blood pressure, or high cholesterol. What can help support circulation? Regular walking, even in short sessions, may help because movement encourages blood flow. Managing blood pressure, cholesterol, and blood sugar matters. Avoid sitting for very long periods without moving your ankles and calves, and don't ignore changes in skin color, temperature, or swelling. Your legs are often early reporters of what your blood vessels are going through. Now here's where it gets even more interesting, because sometimes the cramp is not coming from the blood supply at all. Sometimes it's coming from the wiring. The fourth thing nighttime leg cramps may be telling you is that your nerves are irritated, compressed, or not communicating normally. Many people think a cramp is purely a muscle problem. Not always. Muscles only contract because nerves tell them to. If the nerve signals become noisy, scrambled, or overly excitable, the muscle may seize up more easily. This can happen with peripheral neuropathy, which is nerve damage often linked to diabetes, vitamin deficiencies, alcohol use, or other metabolic problems. It can also happen when nerves are compressed in the lower back, something we commonly see with age-related spine changes. You may think your calf is the troublemaker, but the real issue may be the signal traveling down from the back like static running through a telephone line. What does this feel like? Sometimes cramps come with tingling, burning, numbness, pins and needles, or a crawling sensation in the legs or feet. Sometimes there is weakness. Sometimes the leg doesn't just cramp. It feels restless, twitchy, or electrically uncomfortable. This matters because nerve-related problems can affect more than nighttime pain. They can affect balance. They can affect the ability to sense the floor beneath your feet. They can raise the risk of falling, and for older adults, that changes everything. Practical steps here include checking footwear, posture, and how long you sit in one position. Gentle stretching of the calves and hamstrings before bed may help some people. If you have diabetes, better blood sugar control can make a meaningful difference over time. And if symptoms include numbness, weakness, foot drop, or worsening, balance that deserves a proper medical evaluation. You don't want to wait until the body has been shouting for months. The fifth reason nighttime leg cramps may mean more than you think is blood sugar imbalance and metabolic stress. This one is often hiding in plain sight, even before someone is diagnosed with diabetes. Periods of elevated blood sugar can affect nerves, fluid balance, and inflammation. Over time, high blood sugar behaves like a slow irritant. It doesn't usually damage everything at once. It wears the body down in layers. The blood vessels become less flexible. The nerves become less reliable. The tissues become less resilient. For some older adults, nighttime leg cramps are one of those early clues that the body is not handling sugar as smoothly as it once did, especially if the cramps come with fatigue, frequent urination, dry mouth, blurry vision, or numbness in the feet. Here's the misunderstanding. People often think sugar problems only show up when numbers are dramatically high, but long before a crisis, the body may be sending smaller signals, a little more inflammation, a little more nerve irritability, a little less recovery after activity, a little more cramping at night. What helps? Start with the basics that are easy to underestimate and hard to replace. Steady meals, adequate protein, fiber-rich foods, strength-building movement, and fewer large sugar spikes late in the day. You do not have to eat perfectly. You do have to give your system something steadier to work with. Think of your metabolism like an engine. The more dramatic the fuel swings, the rougher the ride, and if it has been a while since your blood sugar, a 1C, kidney function, or B12 level has been checked, recurring cramps may be a reasonable reason to bring it up. Now let's move to one of the most medically important causes on this list, and one of the most overlooked. The sixth thing nighttime leg cramps may signal is kidney strain or a problem with how your body is regulating minerals. Your kidneys are not just waste filters, they are master balancers. They help regulate fluid, sodium, potassium, calcium, and other compounds that muscles depend on to contract and relax properly. When kidney function starts to decline, even mildly, that balance can become less precise. Think of the kidneys like the control room of a building. If the control room starts making errors, lights flicker, elevators slow down, systems stop syncing properly, in the body, one of those systems may be your muscles. This is especially important after 60 because kidney function may change gradually, and many older adults do not feel obvious symptoms early on, but the clues can show up around the edges. Swelling, fatigue, changes in urination, poor appetite, itching, nausea, or recurrent cramping. And let me say something very important here. If you have kidney disease, heart failure, or take medications that affect potassium, do not guess your way through supplements. I've seen well-meaning people take magnesium, potassium, or electrolyte powders thinking they are helping cramps, when in fact they are making a deeper balance. Problem worse. This is exactly why nighttime cramps can mean more than you think. The solution depends on the cause. What should you do if this sounds familiar? Ask your doctor whether your kidney function and electrolytes should be checked. A simple blood test can be incredibly informative. Quiet, recurring cramps plus fatigue or swelling are worth respect. Not panic, but respect. And now we come to the final point, the one I most want you to remember, the seventh and most serious thing. Nighttime leg cramps may represent is not the cramp itself, but the pattern surrounding it. In other words, when the cramp is accompanied by other red flags, it may be part of a much bigger picture. If the pain is only in one leg and is accompanied by swelling, warmth, redness, or tenderness that could suggest a blood clot and needs prompt medical attention, If cramps come with chest pain or shortness of breath, do not wait. If the muscles are cramping along with severe weakness, confusion, palpitations, or faintness, that could point to a more urgent electrolyte or heart-related problem. And if your leg pain wakes you at night, not just as a quick cramp, but as persistent pain that is getting worse, that deserves evaluation too. This is where many older adults get stuck. They don't want to overreact. They don't want to bother anyone. They tell themselves they're just getting older. But I want to offer you a gentler and wiser way to think about this. Paying attention is not panic. Reporting symptoms is not weakness. It is stewardship. It is how you protect your future self. So what can you start doing tonight practically? Before bed, do a brief calf and hamstring stretch. Nothing aggressive, just gentle lengthening. Stay hydrated through the day, not all at once at night. Review your medication list. Notice whether you also have numbness, swelling, weakness, or walking pain. Support your muscles with regular movement during the day, because muscles that are never used become easier to irritate. And if these cramps are becoming frequent, intense, or strange for you, make the appointment, bring details, time of night, which leg, how long it lasts, what you ate, what medications you take. That information is incredibly useful. Because here is the truth, aging changes the body. Yes, muscles recover a little more slowly, nerves may become more sensitive, blood vessels may stiffen, kidneys may become less forgiving, but common does not mean untouchable, and it certainly does not mean you are powerless. Nighttime leg cramps are often treatable. Sometimes they improve with better hydration, stretching, mineral balance, or a medication adjustment. Sometimes they are the clue that leads to catching a circulation problem, blood sugar issue, nerve condition, or kidney change earlier rather than later, and earlier matters, earlier gives you options, earlier protects mobility, earlier helps preserve independence. If you remember nothing else from today, remember this: your body whispers before it screams. Nighttime leg cramps may be one of those whispers. Not always dangerous, not always dramatic, but meaningful enough to listen to. You do not need to fear every symptom, but you also do not need to dismiss every symptom. There is a middle path: calm attention, good information, consistent habits, timely medical care when needed. That is how people stay strong longer. That is how dignity is protected. That is how daily life remains yours. So if these cramps have been visiting you at night, take that seriously, but take it with hope. Small steps matter, a better routine matters, a careful check-in with your doctor matters, and the body, even later in life, often responds remarkably well when we finally give it what it has been asking for. If this message spoke to you, tell me in the comments whether your cramps happen in the calves, the feet, or the thighs, and whether they tend to strike at the same time each night. And if you want more guidance on circulation, nerve health, sleep, balance, and staying independent as you age, subscribe to the channel and join me again. I'm Dr. Thomas Reynolds, and I'll see you in the next video.